Together we achieve victory over heart failure.
Hi to everyone. I'm Dr. Virendra Kumar. I'm an interventional cardiologist. I'm director and founder of Mediford Wellness Hospital. Today, I'll be giving a small insight into the heart failure status in our country. So, we are as a country are facing a huge problem as a cardiovascular disease. We are a country which is leading there in the diabetes, and these two also combined with the hypertension is the leading cause of heart failure. So country is facing huge problem as a heart failure as a disease, and we are losing lives and daily also. So heart failure is a disease where people loses life, his job, and all those burden is there in the form of financial burden, also on the emotional and social well-being also. So heart failure is a disease where heart ceases to work properly and the pump either fails or is insufficient to pump blood outside to the different organ system to feed. So what we can do for prevent this heart failure? So to prevent heart failure or to manage heart failure, we have to reduce those causes which leads to heart failure. Like if you manage your blood pressure properly, if you manage your sugar diabetes properly, if you have a cardiovascular disease, you must consult those cardiovascular disease and get the treatment properly. Even if you have developed heart failure with your heart pumping less efficiently, you will start those basic drugs, the four pillars of drug properly and titrate those upward. You can get a better result. Other forms of intervention are also there for heart failure. Like beside drug therapy, you can revascularize those coronary arteries. You can have device therapy like CRTD. And for prevention, you must stop smoking to reduce the burden of cardiovascular disease. You manage your blood sugar, you manage your blood pressure. Be active, at least exercise regularly for 150 minutes per week. If you are not exercising, get active, manage your cholesterol level, get the bad cholesterol level below 70, and eat less of the junk food, less of the oily and fatty food, more of the fresh fruits, vegetables, and cut down on the salt, reduce your water intake if your heart pump is poor. If not, then you can take water properly. By doing these things, you definitely reduce the burden of the disease. And by managing those things, it will be very easy to manage heart failure. Usually, heart failure presents as a dyspnea on exertion. That is, people become dyspneic while walking. Many of the patients who are there having coronary artery disease can have chest pain on exertion, and many of the patient will have easy fatigue, not able to do things which he was earlier able to do. So these are the subtle symptoms which can be there in heart failure. If you are not having any disease and you find that there is a new symptom like exertional dyspnea, like you are becoming breathlessness on exertion, you are not able to do daily routine works or any activity which were easily done by you earlier, now you are not able to do now. These can be a signs of the heart failure. You must get evaluated by a cardiologist properly for the heart failure. Once the diagnosis of heart failure is there, you must start lifestyle modification like managing your blood pressure, managing your sugar properly. If you're a diabetic, managing your lipid properly, changing your lifestyle to be active, at least 150 minutes of active walk, or you can get brisk walk per week. You quit smoking. If you're alcoholic, cut down on the alcohol or stop alcohol together. And if you are obese, to set some body weight, cut down on the salt intake, eat more of the fresh veggie and fruits, less of the dairy or other animal products, and adhere to the drug prescription which is given to you by the cardiologist. So by this way, you can definitely reduce the risk of the heart failure. Also, you can manage your heart failure properly if you are a patient of the heart failure. So we as a country facing a huge problem as a heart failure because we are leading in diabetes, leading in the hypertensive, leading in the cardiovascular disease, and current trend shows we have millions of people with heart failure and more to add on. So get active, be change your lifestyle, adhere to your therapy, consult the cardiologist regularly, and get rid of this dreaded disease, heart failure. Thank you.